Hello everyone, this is Aaron Patzer from Vital, and today we're going to start a series on algorithms in healthcare. Notice that I did not say AI in healthcare because, and I wrote a three-part series for Forbes on this, not all algorithms are AI. So in this part, we're going to talk a little bit about classic machine learning. Machine learning can be a bit of a catch-all phrase, just like AI can. But before we get into what machine learning is and how you use it in healthcare, most of the industry, and if you're not in healthcare, most of the business world is stuck on what I would call rules logic or business rules or decision trees or something like that. So in a healthcare context, you see this all the time. There's about 1,000 of these little algorithms, and they're really meant to be done by humans, by doctors and nurses. We work a lot in emergency medicine, so one in the emergency room is called ESI, the Emergency Severity Index. It's very mechanistic. There's probably decades worth of research to support this, but it really only has maybe 4 or 5 variables in it because it's meant to be an algorithm done by a human. The advantage of rules is they're really easy to understand. They're easy to explain in a lawsuit, which happens in healthcare a lot. And they are evidence-based, but they're kind of primitive. They only have a few variables. I mean, if you were trying to determine whether someone's emergency condition was severe, it kind of depends on a lot more than just their vital signs. It might depend on their age and what condition they showed up with. That's when you use something like machine learning, because it'll parse out which variables out of hundreds or even thousands or tens of thousands are most important. And so what machine learning does is it's typically what's called classified or supervised machine learning or algorithm, where you kind of know the outcome. So you take 1,000 or 10,000 or 1,000,000 cases where you already know, were they admitted to the hospital, were they discharged from the hospital, and you put those in as training data, and it figures out that 16% of the weight should be blood pressure and 3% should be the person's respiratory rate, and only 2% should be blood oxygen, or whatever the condition might be. So in some sense, instead of writing these hard-coded business rules, it's creating flexible business rules based on the empirical data of what actually happened. And as a result, it can be far more accurate. That ESI algorithm that I mentioned, 70% of people are stuck in category 3, which is like this I don't know category. 1 and 2, very severe. 4 and 5, probably shouldn't have gone to the ER. 3, I don't know. 70% of people are stuck there. So it's not very differentiating because it doesn't use enough variables. It doesn't use enough data. It's not taking advantage of the big data world that we live in. And that's where machine learning shines. Where machine learning falls short, and what we'll talk about next time, is it's only one layer of interaction. It's typically done with like a linear or a logistic regression. You don't need to know the math terms. You don't need to look them up. But it doesn't know, for example, that being overweight with high glucose might lead to diabetes. Diabetes might lead to complications of your kidney or stroke, increased risk, which then leads to a higher rate of readmission or death or something like that. That is a task for neural networks. And that is where we get into real AI, and that's in the next episode. Thanks.